Hello, I'm Jeremy Clark, Market Chief Executive Officer at Hilton Head Hospital, and I'd like to welcome you to another edition of our show, Healthy Living. We use this show to highlight the physicians, programs, and services that we offer to help you live a happier and healthy life. We are very proud to have been delivering extraordinary care right here at home for over 40 years. And so, on behalf of the physicians, colleagues, and volunteers at Hilton Head Hospital, I want to thank you for watching, and I hope you enjoy the show.
Pain. It can be different things for different people. A shoulder that takes you out of the game. A knee that stops you in your tracks. Ready to return to a better you? Hilton Head Hospital is here, right in the Lowcountry, to help heal what hurts. From diagnosis to treatment to full recovery, our fellowship-trained orthopedic specialists are committed to getting you back to your best. Hilton Head Hospital. Extraordinary care right here at home.
No one likes to wait, especially in any ER waiting room. I mean, when I'm sick or my family has a medical issue, I don't feel like waiting around with a lot of other people. Not to mention they're sick too. Honey. And my family does not wait patiently. You can imagine how uncomfortable and how long it can seem. But then I found out it doesn't have to be that way. I can check in online and wait anywhere I want. What's not to love?
It's the smarter way to ER at Hilton Head Hospital.
Hi, and welcome to Healthy Living. I am Debbie Lyons. I'm here today with Amy Anderson, and we're talking about stroke, and we're talking about all the wonderful things that are happening here at the Hilton Head Hospital. Yes. It's been great. Thank you for taking time today. A little bit about what you're doing here at the hospital and your background.
So my background is nursing. I've been a nurse for about 20 years.
Okay.
My background is ER. I'm from Michigan. I've been here for a few months, love the island, love the people. I think it's a great opportunity to have come to this hospital. And the best part about Hilton Head Hospital is that they've committed to excellence in stroke care and chest pain. So when I originally came here, the goal was, and still is, to be certified by the Joint Commission for both of those programs.
It was so fun when we were talking ahead of time. You're like, oh my gosh, you are so excited about all of this. I said, oh, are you excited about doing the show? You go, absolutely. You said one thing, people don't really know that we have an open heart program here.
Yes, we do have an open heart program. So our physician, Dr. Castle, does open heart surgery here. In fact, I've met a lot of people in the community that have had surgery by Dr. Castle, and we're very happy. And it's something important to know that a hospital our size is actually able to do that. And not only that, but to pursue these two certifications is big. In fact, we will be the only chest pain certified center in this area.
Well, let's talk a little bit about what the certifications are. Talk to me about both of them.
So Joint Commission is the accreditation body for hospitals across the United States.
Okay.
And what they do is make sure that we are giving the highest quality care to our patients, the safest care, the most evidence-based care to our patients. So, you can go with that accreditation alone, or you can continue to raise the bar by getting extra certifications, and we are getting our stroke and chest pain certification.
And what does that mean for us? What do those look like?
So we are constantly, we as an interdisciplinary team for both diagnoses, stroke and chest pain, get together on either a bi-monthly or monthly basis, and we work on each and every piece of the program. So on a day-to-day basis, for instance, if you were to come into the hospital with a stroke or a heart attack, we would immediately activate a stroke alert.
Okay.
That would let the whole hospital know and all the departments know that you had had a stroke. The same thing with heart attack. So your CAT scan people, your cath lab people, the physicians in charge of those patients would all be aware that now we have to get you immediately to the CAT scan. So if you were to come in by ambulance, you would go directly into that CAT scan machine.
Wow.
You wouldn't even stop in the ER, and that is best practice.
Okay.
So those are the types of things that people don't know. You'd immediately get an EKG within 10 minutes or less. You'd get to the cath lab, because all of these are time-sensitive diagnoses that would require medications to cure the stroke, potentially to lessen the deficits, and then maybe take you to the cath lab if you were having a heart attack to get that intervention to open up that blockage.
Talk to me a little bit about the physicians that you work with in your affiliation.
So we have a great team of interventional cardiologists, and then Dr. Castle is our cardiothoracic vascular surgeon. And then we have our team of cardiologists, and then in addition to that, we have 2 neurologists on staff and an agreement with MUSC for telestroke and teleneurology.
And what does that look like? Actually, I've had the opportunity of seeing that. It's pretty cool.
So we do that at our coastal facility already,
Yes.
and we are going to be doing that here as well. That is kind of the way of the future. With hospitals, not just with stroke, but with, psychiatry, with many other specialties. You would actually get a Skype consult with a physician on the other side. So they'd be going through the actual, stroke assessment in real time, and be seeing you. In fact, a lot of, things are being done like that on ambulances, even in the field now. And so you're getting a real-time assessment not only in the ER, but up in the inpatient unit from a physician on the other side of the camera, and they're actually able to do an assessment in conjunction with one of our hospitalists.
One of the things that you said that is really interesting is that part of the reason you're doing this for stroke and chest pain is that it is time sensitive. It can make the difference between health or not.
Right. So when you think of time-sensitive diagnoses, you think actually in the 5 really leading causes of death: trauma, stroke, and heart attack.
Okay.
Are in the 5 leading causes of death. Heart disease being the first leading cause of death in the United States, and stroke being the 5th leading cause of death.
I didn't realize
Yes.
that. Okay.
Only second to traumatic injury. So when you think about the time-sensitive diagnoses, it's all based on the recovery of you as a patient. So, with stroke, we are able to give medication, a clot-busting medication, that if you come in within a certain window of time, that we can potentially give you that medication if you meet the criteria. So the FDA gives us criteria on that medication administration.
Let me ask you from a practical point of view. So I'm at home and I'm feeling chest pain. Of course, we're women. We are terrible at this.
Yes.
Right. Okay. We need to be better stewards of our own bodies.
I agree. Women in particular. So I round on all the stroke and the chest pain patients that are admitted to the hospital, and a large part of what I do is education. And talking about prevention, and recognition of symptoms. So we as women do not manifest, heart attack symptoms the same way that men do. Many times the symptoms are very vague. So you can have symptoms of indigestion, nausea, general weakness, numbness down an arm, pain in the jaw. It's not always just crushing pain in the chest. You have to look for it in your jaw, in your neck. Numbness down your arm. Nausea in particular, especially with diabetic patients, they don't manifest heart attack symptoms the same way because they just don't have as good of a vascular system that other healthy people would have.
Is there a demographic? Is it men over women, women over men? Is there age? Is there any other kind of
So, it's an aging population, obviously, but
Yes, we are.
Across the United States, because we have more and more medications to give patients to keep us healthier longer. But the key is to also know that younger and younger patients are having stroke symptoms or strokes and heart attacks. I mean, I see patients in their 30s with strokes and heart attacks. And a lot of it is based on family history. So it's important to be aware that, if I'm a young man and I'm in my 30s and my father and my grandfather died of a heart attack at the age of 50, I'm at very high risk to have a heart attack. And I should be aware that, I should let my primary care physician know that in my family history. So that's why your primary care doctor is asking, do you have a family history of stroke? Do you have a family history of heart attack, cancer, all of these things? so that they can treat you accordingly, preventatively.
What are other heart attack and stroke, not symptoms, what am I trying, predisposing factors? In other words, is it overweight?
Yes, it is.
Precipitating factors.
They really go hand in hand, stroke and chest pain, because high blood pressure alone puts you at high risk for stroke and heart attack. Uncontrolled high blood pressure, diabetes, high cholesterol, obesity, smoking, that's a big one. We really encourage the patients to stop smoking. That's one of the most difficult ones, a sedentary lifestyle. So I don't only just talk about, the importance of taking your medications, but the importance of lifestyle
prevention,
changes.
Lifestyle.
Yes. Even if you can get, we live in a beautiful place. If you can get out for 30 minutes a day and walk on the beach, you're doing better. 30 minutes a day, they say that a sedentary lifestyle makes you predisposed to heart disease now. They've shown that in research. So you really have to make an effort to do as much, as much as you can, unless you're not feeling well. Some of our patients are very sick, so they only can do what they can do.
Once you have a stroke or you have a heart attack, rehabilitation?
It's very important. So we have an excellent cardiac physical therapy, occupational speech therapy program here. And not only will they see you daily in the hospital, but they will see you after you leave the hospital. Because really, with stroke in particular, it's all about the outcomes. It's a very debilitating, problem. So we want to make sure that we get you as close to your baseline as possible.
What we're going to do, Amy, is we're going to take a quick break here on Healthy Living. We'd like to come back, and can we talk a little bit about chest pain in general, okay, because we hear it.
Yes.
You described it for women, but again, what that really looks like, and then what stroke really is, and what the symptoms may be for that. So stay with us. We'll be right back here on Healthy Living.
Pain. It can be different things for different people. A shoulder that takes you out of the game. A knee that stops you in your tracks. Ready to return to a better you? Hilton Head Hospital is here, right in the Low Country, to help heal what hurts. From diagnosis to treatment to full recovery, our fellowship-trained orthopedic specialists are committed to getting you back to your best. Hilton Head Hospital. Extraordinary care right here at home.
Hilton Head Regional Medical Center is located at 25 Hospital Center Boulevard. When traveling east on William Hilton Parkway, make a left-hand turn on Beach City Road, and the next left, Hospital Center Boulevard will be located just past the Hilton Head Library.
Coastal Carolina Hospital is located on US 278 at Exit 8 on I-95. Telephone is 843-784-8000. On the web, www.coastalhospital.com.
The vision for Hilton Head Spine Center is very clear. It's to provide world-class spine care to our patients.
Physical therapists were there. They were there holding you up. It's nice.
I just love working with all of these patients and their families and getting to know them and helping them on their journey.
My life is definitely better, and I'm glad that I came here at Hilton Head Hospital.
We are back here on Healthy Living. We are talking with Amy Anderson, and we're talking about stroke. We're talking about chest pain. She absolutely loves what she does. She is an expert in her field, and it's too bad we didn't have the cameras rolling because there's a lot to talk about. One of the things that you talked about was, and one of the things I asked about is kind of the definition of chest pain and then more signs and symptoms of stroke.
So if you think about stroke, in fact, one of the things that I do when I educate our patients is I give them a nice little magnet, and it's called FAST. So when you think about stroke, you think about an acronym called FAST. So facial drooping.
Okay, which I would notice. Someone else would probably notice it. Okay.
Right. It's very difficult to see some of these things in yourself, but really your coworkers may notice it, your family members may notice it. It's something that I teach to the entire family or to the caregivers. So facial drooping, if you smile and you can't move on one side of your mouth. Arm weakness would be the A.
Okay.
And that would pertain to leg weakness as well, but we say arm weakness as in the acronym.
Either side?
Either side, both sides, either side. When we do a full examination on a stroke patient, we look for, the ability to hold your arms out, hold your hands up. Can you do that? If not, then, we give you a scoring based on all of these things. In addition to that, speech. Sometimes stroke patients have difficulty speaking or understanding speech.
Okay.
So the way that the brain works with a stroke, you can have, difficulty maybe slurring speech, getting your words out, word jumble, like a word salad, or maybe you're not understanding what I'm saying to you. So it all depends on the part of the brain that's affected. And then T would be time. So 911. I tell all my patients, if you're exhibiting stroke type symptoms, and we'll get into chest pain in a minute, but you must call 911. And the reason being that an ambulance is going to get you here faster and start an IV and give you medications and give the hospital advance notice that you're coming so that we can get the team ready. That's really important. And if you're having stroke symptoms, it can get worse. If you're having chest pain, it can get worse. I have seen patients trying to drive to the hospital and then they deteriorate and they actually go into cardiac arrest and they get in an accident. So it's very important to utilize the EMS system. We have a great relationship with the fire departments and EMS. They're really up. In fact, we just did some stroke education with them, a couple weeks ago. They have an excellent, they give us pre-hospital notification if you're having a heart attack.
What is a stroke? How about a basic question?
Okay, so there's two types of strokes. You have an ischemic stroke and a hemorrhagic stroke. Those are kind of when we think about blood in the brain or clot in the brain. So the typical symptoms of having blood in the brain, it can be caused from a traumatic injury.
Okay.
But if it's not a traumatic injury, it can be from a brain aneurysm.
Okay.
That may have ruptured, and at that point you'd probably have the worst headache of your life. And you may even have some difficulty speaking. But when you have blood in the brain, typically you have a lot of swelling, so you have a very severe headache and maybe collapse. With an ischemic stroke, typically it's caused from a blood clot, that's in the brain, and it's caused either by a blockage, from high cholesterol, blood clot, that's come off maybe because you have an abnormal heart rate.
Got it.
And then it causes a blockage in one of the arteries of the brain. So you have, some main arteries in the brain, and then you also have some very small vessels. So depending on the location of where that stroke is how you'll be affected.
Is a stroke always in the brain as opposed to carotid artery?
So it can be in the arteries. So not only will we check you with a CAT scan of the brain, but we're going to check your carotid arteries, your two major arteries that run along here. Because the blood flows up, obviously, so you could have a blockage. Plaque formation in there or whatever, and then you have a blood clot.
When you go to your primary care physician before you've been diagnosed, and we talked in the previous segment about lifestyle, family history, and things like that, is there, if you have that, are there precautions you can take?
Definitely you want to, and I always, tell patients, lifestyle changes don't have to be drastic.
Okay.
They can be, very minor. For instance, if you know that you're predisposed to high cholesterol, when I go out to eat, I have that problem. I say, no butter, no oil in my food.
Got it.
I pull the skin off of my meat. I go with leaner meats. I go with, whole grains, fruits, and vegetables. So if you think about lowering the fat level, less high fat, butter content, it doesn't mean you have to do this, every day.
Every single day. You can have a fatter day.
Yeah, every now and then you can certainly do that.
What are the rules? I often heard 81 milligrams of baby aspirin. Was that for a heart attack or a stroke?
It is. So it doesn't hurt to take a baby aspirin a day, obviously, unless you have some type of bleeding in your stomach. But it certainly is a protective mechanism to take a baby aspirin a day. We give you aspirin. In fact, when you're having a heart attack, the first thing that EMS will give you is aspirin. That is still top of the line medication for when you're having a heart attack. And then, of course, we go on to give the bigger medications. But it's important to be aware that if you have a family history, if you have high cholesterol, if you're a diabetic, high blood pressure, if you're a smoker, all of these things will predispose you, a sedentary lifestyle, to stroke and heart attacks.
And you have to pay attention to how you feel.
You absolutely do.
Now, I noticed that you say it's stroke and chest pain as opposed to heart attack.
Yes.
Help me with that.
So there are certain things that we look at when you're having chest pain, and we find them on an EKG.
Okay.
So,
and I'm having chest pain. What does that look like or feel like? We hear that so often, but
it can look like a lot of different things. So sweating.
Oh.
Sweating is a common one. Nausea. The feeling of indigestion just won't go away.
Okay.
You know, I get that a lot. You know, I've had this indigestion for a few days. I've taken antacids. It's just not going away. I feel like an elephant is sitting on my chest. I can't breathe. My jaw is hurting. I'm having shoulder pain. So it's a lot of different things. So know how your body feels.
Okay.
If it's not feeling right, you need to get seen. Especially if you're exhibiting those classic symptoms, the sweating, the nausea, the chest pain. Those are classic symptoms of a heart attack.
Are there certain times of, this is a silly question, certain times of day that people have heart attacks?
No.
Is it more men or women or?
No, in fact, it's interesting. I've had people wake up in the middle of the night having a heart attack. I have. Chest pain has woken them up from their sleep, and they're having a heart attack. You know, certainly you would think, oh, it's when I'm stuck in rush hour traffic.
Right, and the stress is, right.
But it can be at any time. It can affect men and women alike. I think as women, we don't pay as much attention because our symptoms we're just blessed with the fact that our symptoms are more vague. Diabetics, the same way, more vague type symptoms.
One of the things that we started talking about is post-heart attack or post-stroke, about the rehab. We have a wonderful cardiac rehab here.
Yes.
What does that look like for most people?
So our rehab department will actually come and see you while you're in the hospital, and they will set up a whole program with you and your cardiologist to say, you know, we're going to have you come, you know, this many times a week. We're going to have you do some work on the treadmill, you know, maybe just something lighter. It just depends on what they think you can start out as.
With what goal? What is the goal of rehabilitation like that?
Well, it really is to see how much you can do without having that chest pain again, to make sure it's not coming back, and to, you know, see what you can do on a daily basis. You know,
Am
without
I strengthening the muscle, the heart muscle?
No, not necessarily. You're just seeing how much exertion you can take in the real world.
Got it.
So, you know, what would I be able to do for my activities of daily living safely? So they'll continue to take you through different levels to see, you know, what's safe for you. And, you know, it could be, you know, a couple weeks, 6 weeks, 8 weeks, you know, so we just want to see what's going to help you in the real world exertion-wise.
And last but not least, let's kind of go back to the reason that we're doing the show today, and that is to talk about some certifications that you all are getting. Once again, just to kind of reiterate.
Yes, so, you know, the Joint Commission obviously is the accreditation body for, like I said, most hospitals across the United States, and that's what we base all of our quality measures, our excellence in patient care. They come and survey us for our, you know, regular surveys quite often. But in addition to that, if you want to provide, you know, you want to raise the bar, you get these additional certifications, and you provide this team approach on a daily basis for these patients. So we decided to do that with stroke and chest pain, which is outstanding because it's going to provide, and already is providing, an amazing service for our community. I think just the education that we provide for the patients alone on a daily basis is really outstanding because it makes them feel safer when they leave the hospital.
Because we are. Thank you so much, Amy, for joining us. We want to thank all of you for joining us here on Healthy Living. Have a great day.
Thank you.